Welcome everyone. Today we have our another new episode, and we have our young speakers, Mr. Saleh and Mr. Kumar. So today we're going to discuss about remote medicine. This is very important in terms of developing nations. One of my friend from India, but he live in Scotland, and another friend from Bangladesh. So they may discuss some different dimensions about remote medicine. First, I want to give chance, Mr. Saleh.
Thank you, Professor Sharif, for inviting me in this discussion. Yes, the remote medicine is quite popular nowadays in terms of Bangladesh. So especially now, as a person, I have seen is this popularity due to the ongoing COVID pandemic. Many doctors are not available in their private chambers. Instead, they prefer virtually meet with patients. So in this way, in this pandemic situation, this kind of technological disruption is happening in the healthcare sector of a developing country like Bangladesh. And like as we all know that due to the lots of population figures, we have a very insufficient number of physicians. So definitely there are huge pressure in the medical centers all over the country. So the remote medicine is like a blessing in this healthcare service of Bangladesh. So, actually, I would like to discuss more in if I get the opportunity in the coming future. But yes, so the remote medicine is a quite popular features nowadays in developing countries. So yeah, thank you.
Thank you, Mr. Kumar. What's your experience in Scotland, as well as how you want to share your experience and view about remote medicine?
Definitely. Thank you, Sharif. I mean, it's great to meet you again. And I mean, as you said, I mean, there is a huge difference I face from India to Scotland. See, whereas in remote medicines or remote consultancy back in India, I mean, still, I mean, people try to go to a doctor personally and try to approach them. They don't want to take advice remotely. But whereas in Scotland, right after I land, right from the COVID test, I didn't interact with human being. Everything has been sent to my location, right from my enrollment or a COVID test or consultation or anything for that matter. Everything is based on app. Everything is based on system-driven function here. So that was quite interesting for me, the transition which happened from India to Scotland. And in general, if you ask me, I've seen people back in India, they are into a lot of stress, I mean, consulting many more people in a day. There has to be a system where it has to be consolidated. There should be a periodic number of people, and then there should be some regulatory or a policy which will help doctors to perform their job better. But in Scotland, it is already done. And I think due to a population, they are quite accessible at any point of time. And if I need a consultancy, I mean, based on my NI number, they can refer it, my history, medical history, my current location, everything can be accessed. And based on that, the advisors have been provided. So in that way, I mean, this remote medicine is doing wonders in these countries.
Thank you.
Thank you.
My friend, Mr. Uguchuko from Africa, he also joined. Uguchuko, can you hear me? I think he has internet issues. Mr. Saleh, one thing, like as you are in academy, like when we develop this kind of remote medicine process, we need a lot of research, as well as we need to integrate with the grassroots level people, because uh, we need to provide this kind of remote service to the grassroots level people. So what's happening in Bangladesh, and what is the present situation for healthcare research?
Okay, thank you. So actually, basically, this is not my area of research. Actually, I'm doing research in sustainable development and climate change. But yes, I can discuss it related to my sustainable development knowledge. So as you all know that SDG 3 that actually covers up health and well-being of people. So definitely, remote medicine service in Bangladesh is serving well. Although, as I said before, that due to huge population and an insufficient number of physicians all over the country, it's a kind of challenge. But actually, I have seen very progressive in this area. And recently, actually, I have contacted with an Indian doctor based in Bangalore for my mother's treatment because my mother is suffering from kidney disease. So we consulted with an Indian doctor through Zoom. So that's why yes. So definitely it's a very good indication that we can contact doctors from all over the world. So actually it also helps us to, because actually before inception of such kind of services, like we used to travel India. But actually due to the ongoing situation, it is sometimes quite impossible to get a visa because of the COVID restriction. But this sort of remote medicine services, we actually easily get contacted with foreign doctors, and we take advices from them. So yes, so actually in Bangladesh is happening well. And I have searched such papers on Google Scholar and Scopus, and I have found a couple of papers that is written based on Southeast Asian remote medicine service, or telemedicine service, or as we say. So yes, so there are some research as well. But actually, as we all know, that there are more research papers are coming because on the focusing of the ongoing pandemic situation. So yes, this is these the new innovative features for research to assess the contribution of of this service in the terms of developing the sustainable livelihoods in developing nations like Bangladesh, India, Sri Lanka, or maybe some African countries as well. Yeah.
Thank you, Mr. Kumar. Actually, both of you, I like both of you because you are expert and you are developing your career in sustainability. So when we discuss about sustainability, we have to think about all of the sector: water, energy, even healthcare, smart cities, human rights, everything under sustainability. So, Mr. Kumar, what is your view? Because you are also a researcher, you develop a lot of startup. Do you have any startup for healthcare system or for remote healthcare or anything you want to share with us? I know you have a lab.
As he rightly said, uh, my core area is on sustainability and eco innovation. As you rightly said, we concentrate on three things. One is social, economical, and environmental. These three things for any product, even this remote medicine or a remote consultancy. When I see socially, it is very good. At the moment, it's helping many people. As he rightly said, our friend, from sitting there in Bangladesh, he can access an Indian doctor. It is quite possible nowadays because of the internet and the technology what we have. And economically also, this saves a lot of resources. Money in terms of time and anything. And environmentally, we save, you know, the logistics. If you want to come here all the way from Bangladesh, you have to spend. We have to exhaust the fossil fuel. So we are saving many things. In these three parameters, if you ask me, this remote medicine and the remote consultancy is a great thing. And I've been part of. I've not started a company for this, but I've been part of a remote accessibility. Remote medicine and remote consultancy company where they asked me to do this, a basic understanding of a person from the psychology point of view. How do they think? What is the cognitive perspective of any human being when they come into uh, in a virtual room to attend a consultancy or a medicine for that matter? So we are trying to understand these three factors: the social, economical, and environmental factor. We're trying to give an awareness and also educate them because they feel want the physical attention. Somebody has to hold their hand and check what is happening, and they want to have a direct conversation, human to human. But we are slowly taking things in a different way. We are saying that the same thing can be done virtually through these three factors. So in that way, I'm quite happy and excited to work in this area, and which is really, really helping our goals, all our goals. I mean, I know Sharif, I know Salim, everybody is working towards sustainability and eco-innovation. It's really helping us to achieve that.
Excellent. Today's session is very exclusive because all of the young, talented people is
Mm.
here, and all of them actually originate from, including me, from developing nations. So our World Talent Economy Forum is an advocate for modern science, engineering, and technology for developing world. So I believe this dialogue will be very helpful for our country. Uguchuku, he is also from TAF, Transdisciplinary Agora for Future Discussion.
Mm.
And I believe that they have a very important summit next March. So, Uguchuku, what you want to add? We are discussing about remote medicine. Especially, we want to know the remote healthcare system in Africa. Uguchuku, can you hear me?
Okay. Thank you so much for bringing me. Yes, I can hear you. Can you hear me too?
Yes, sure.
Can you hear me?
Yes.
Okay. Okay. I'm happy for your invitation today in this show because this particular aspect of discussion is very key in bridging the hiatus in the broken healthcare system over here in Africa. Because frankly speaking, the only way through which the young ones around this yeah, can have an edge, a competitive edge in the area of medicine is through virtual medicine, through remote medicine, or otherwise as call it telemedicine. And if you go by the statistics of the World WHO, you find out that the number of sick people in Africa, is quite enormous, and the number of related deaths, mostly occurring in the villages and in remote part of Africa, is because of lack of access to basic healthcare facility. And that's where telemedicine comes to bridge this gap and democratize access to healthcare to people who otherwise wouldn't have had access to them. So telemedicine, as let me speak from Nigeria, where I come from. The use of telemedicine dates back as far back as 2007, when the National Agency for Space and Research, in collaboration with the Ministry of Health, tried to inaugurate some what we call health kiosk, like a small place where people go to buy some things, health kiosk, where people can easily access medical services. Because with the increase in the number of rates of women who die during childbirth, this become necessary that people can actually access healthcare in a way that we have in in improving the healthcare educational system. But the problem is, with the advent of COVID-19, it became more necessary, if I use that word, it became more necessary that telemedicine, you know, is kind of needed to be built because people can't go to hospital anymore for fear of contacting COVID. People can't associate anyhow. So the only way is to contact a remote doctor to give you access, to give you knowledge on how to manage your own core healthcare health challenges that you have while in your home. So there are divergent companies that goes towards that in Africa, and we hope to improve on it as we go towards it. But it is actually a key element in the region of the healthcare hiatus we have over here in Africa, especially in Nigeria, where I come from.
Thank you. like one thing, Mr. Saleh, I want to know, even as we work with different developing nations. Recently, we work with Rwanda governments as well as their local collated lab. Uh, so I just want to know what is the, let's say, some point I saw even Africa has many discipline activities in terms of sustainability, what you are expert in, circular economy. They are also taking many initiative. I do not want to say everyone 100% success, but in terms of knowledge gathering, in terms of innovations, in terms of contribution, they are also taking a lot of initiative. What's happening in Bangladesh? What is your view?
Mm.
Because example, I am sure that with your TAF initiative, anybody can impressed. They are developing many high quality innovation. They are developing high quality research publications, as well as they have a high quality conference for industry 4. But what about Bangladesh? What's
Mm.
happening? How they
Oh.
integrated with the knowledgeable, like knowledge-based platform or knowledge-based activities?
Yes, so thank you. Yes, in terms of remote medicine services, I have seen the tremendous development in a couple of years, and as I said before, due to this pandemic, this development has been accelerated. More cell phone apps has been developed in where people can virtually and remotely communicate with doctors and physicians, so on. Even if there are services where where the attendants can take samples by coming home, and you don't have to go to the test center for testing COVID. Yes, they actually only facilitate this service only for those who has some symptoms. But yes, if I would like to go to in a foreign country, then definitely I'll have to go for the test center. So yeah, so there are developments, and I have seen some sort of conferences, but yes, so there should be more research platforms should be established. And recently I have seen that many universities are keen to develop their research profiles lately. But yes, it is quite appreciated that nowadays universities are recognizing research activities, and universities are now creating funds, and governments are also pressurizing universities that yes, you have to you have to develop research centers, you have to publish papers in order to make progress in global university rankings. Yes, there are activities are there, and yes, definitely, and this sort of activity should be sustainable. It means this this sort of activity should be persistent. It should not be stopped anywhere. So it should be continue. And as you say, as you always say, that we are the talent people, we are the young generations. Yes, so we actually prefer research works in terms of which we are nowadays considered as the main things in academic perspectives. Personally, I am conducting research works activities, and I'm trying to publish my papers in reputed journals, as I have already two papers in Scopus Q1 journals. So yes, there are some revolutions, there are innovations, but yes, in terms of comparing with Africa, yes, I have also seen their developments in my areas, that is circular economy and ethical consumption. And I've been invited to one of their programs. uh, that was a circular economy show in Rwanda, and another program what a circular economy show in Africa. So I have seen their innovation, I have seen their activities, I have seen their research works. It is really highly appreciated, and I must say that we we haven't known about the contributions. But actually, after attending their shows, and after participating their roundtable discussion, I have learned many things, that yes, as developing nations, couple of African countries are doing much better than than many other developing countries all over the world. Definitely, it's really highly appreciated.
Thank you, thank you, Mr. Kumar. You have a very good contributions, I believe, in southern part of India, as well as now you are doing research in Scotland and some of the famous universities. What is the difference? Do you believe that we know the southern part of India, they are very advanced in research and innovation? So, is there any difference in between Europe and southern part of India, or how you are actually collaborating, or how you are working together for innovation and research?
The straight difference would be the policy and the regulatory norms. So straight away, that's the difference I see. In terms of research, I feel grants are pretty much available in UK, whereas in India, I mean, the industry we have to approach, we have to write a letter, which is um, a lack in South India. But the point is, like, still we can do a lot of research, publish papers. But in UK, it's been allotted, and it's sitting in their universities. Say University of Glasgow, which I mean, last week I've been there. I saw what is the amount of fund exclusively for this sustainability, the circular economy, which we are talking. They said it's almost 171 trillion pounds, which is sitting right there. So anybody who has a good uh, research, has a good solution for the existing problem, they can go and present it. And if the university approves it, they can get it straight away. So that's the easy access, the policy and the regulatory board, which is much accessible at the moment in UK, I can see. Whereas in India, we have to approach the industry as well as the university to collaborate, and we have to give a proposal and start our research and submit our thesis. So in those are the difference I feel. But whereas the talent wise, as my friends were saying, I see a lot of people from Africa doing this sustainability course, the circular economy course, and eco innovations. They are doing it. I mean, and people from Nigeria, Uganda, I mean, a lot of areas. I mean, they're trying to put themselves in this shoes and creating the awareness to the rest of the world. I mean, I'm really glad to see such things happening. And of course, we are the younger generation. We can adapt to these technologies and these new methods. Whereas I see in the behavioral pattern, when the elderly person comes, we have to educate them with all this technology. At the moment, it's quite difficult because they are the one who's getting sick, and they are the one they want this remote care and the remote consultation. And the young people can adapt themselves really fast, and it's much easier to teach them at the moment. So these are the difference I feel. Yeah.
Thank you. Ugo, what's happening in Africa? I believe both of my friend actually highly appreciate the young generation initiative in Africa. So, if you share some of your healthcare related projects or research in Africa, it will be great for our audience.
Okay. Thank you so much, Saleh and Kuma. I really appreciate the kind words which you have for the great continent of Africa. Because like I said, I'm from, I'm from TAFS, which is a transition agora of future discussions where we aggregate minds to discuss about challenges facing humanity. And when it comes to telemedicine in Africa, it's actually, even though I can say that it is at this nascent age, but the young people are really taking up this project. We have many companies that have, you know, founded technology companies founded by young people that, you know, are dedicated to ensuring that telemedicine gets towards many people in Africa. But some of the challenges that we have, you know, some of the challenges that we have is actually twofold: the provider challenges and the the patient challenges. In terms of the provider challenges, we see that there are terms of inadequate infrastructural development. Because telemedicine requires a high level of infrastructure development, which has to do with high resolution of digital cameras, specialized medical examinations, softwares, computers, hardware, even servers, to ensure that this is, as in, the services is adequately provided to people. But some of these that I mentioned are actually not fully available, or actually not equitably distributed, especially when it comes to the rural area. And furthermore, some of the hospitals in the rural area don't even have steady power supply. So one of the challenges we face here in the third world countries is the issue of power. The lack of steady power supply, inhibits, our progress in the area of telemedicine. Even when these young people find, like I said, some health kiosks where they try to make sure that healthcare reach towards the people at the rural areas. And then another challenge that faces young people who try to set up telemedicine in Africa is the issue of the high cost of setup. High cost of setup, because to the cost of those specialized equipment, like camera screens, video conferencing, um, and other telemedicine facilities are so high that young people who try to bridge these challenges in Africa, even though they still encounter this and try to surmount it, find it like a bottleneck. It's a daunting challenge for them to push forward on that area. And another thing is the issue of the mindset of our people. Sometimes, like Kuma said, the old people who actually need this thing more are skeptical of the adoption of telemedicine. In essence, that was who need because to move them from the house to the hospital is actually daunting. It's about they're not too physically strong to engage in that, but they find it skeptical when you ask them that, from here, from a hospital there, they can be watching the screen and they'll be doing the procedures to ensure that they get better. So that mindset is another bottleneck that that resistance to change is to adopt something new is actually a barrier to that we young people encounter when it comes to the issue of telemedicine. And another note is that on the part of the patient, to actually procure the things that we need, that they need to be monitored. Like I have a friend in US. The dad is sick here in Nigeria. He has to install some medical equipment, in the house, so as to monitor the dad's health from US. So, but not everyone can actually have such amount of money to buy those equipment. So the lack of affordability of telemedicine services, we actually we have a young person who has founded a health kiosk or a telemedicine facility, but to be patronized, and so that both the patient and the provider can come together to achieve the aim of qualitative health care, that gap of high cost in terms of both the patient and the provider is actually there. And then, well, on the maybe I stop here, but the fact is that some of these challenges, all boils down to the issue of kind of financial incentives, which is our major problem, and then infrastructure, which is it. But the young people keep pushing because we have many telemedicine facilities. Here in Nigeria, we have 247 telemedicine facilities. We have healthcare evaluation services, telemedicine facilities. We have prospect telemedicine facilities. There are so many of them, but this challenge still inhibit the potency and the achievement of qualitative results when it comes to telemedicine here in Africa.
Thank you. This is really great. There are some question from audience. From Onika Shams, she want to know how do you assess telemedicine? So, Mr. Arman, what you want to add for this question?
Okay, so in terms of assessing the telemedicine, first of all, I would like to focus on the factors of the severity of the disease, because actually if a particular patient is suffering in very severe way, then maybe remote medicine service may not suitable option. Rather, it should be focused on the physical contact with between patient and physician as well. So second thing is, and I like to put emphasis on the access of internet facilities. Like as we know that without internet facility, telemedicine is utterly impossible at this moment. So actually, people prefer video calling or calling facilities over Zoom or WhatsApp, suppose. So through these features, they can they can serve telemedicine service. So definitely, in terms of assessing the telemedicine service of a particular particular country, then secondly we need to assess the strength of the bandwidth service of the internet, and definitely the the infrastructural facility of a particular medical center is also an important factor, because they have to they have to put such sort of amenities where consultants can facilitate uh, patients from the remote areas. So those are the things I think that may be the successful criteria of a particular remote medicine service. Maybe there are other options. Maybe other speakers can insert other aspects as well. Yeah.
Okay, sure. Mr. Kumar Mehdi want to know how do you evaluate the effectiveness of telemedicine? Can you unmute, please, Kumar?
Yeah. So to check the effectiveness of telemedicine, I would say two factors. One is, see, at the moment, I can see the history is there in the database. So the doctors can see the database instantly. So based on that, they can propose a medicine rapidly. And from the doctor's point of view, they put a priority because not everybody can get the access instantly. They will, based on the priority, like say somebody will have low oxygen level, some may have a severe cold, they may have been high temperature. So based on that, even that, I mean, the systems have been working on, they're writing an algorithm for this. Based on this, they put everything in place, and then they bring the people in priority list. So if, in that way, they can solve this issue. And the second thing, which as I said, that based on the database, they can bring the um, right medicine for the person. So it's all depends on the algorithm now. So in that way, I mean, we can bring the effectiveness.
Thank you. Thank you, Madam Durgadash, for joining today. Uh, there is another question, Nur Fazrin. Uguchuku, you can respond. What is remote care? So, can you give the conceptual idea of remote care?
Okay. Yes. Sure. Simply stated, remote care is simply the delivery of healthcare services, by professionals using ICT, that is information and communication technologies, to to exchange information for diagnosis, both treatment and prevention of diseases, in a continuation of healthcare in a way that reaches others without a physical contact between the healthcare provider and the healthcare recipient. So the major factor here is that it is reliant on information communication technology. That is, through this information communication technology, healthcare can be delivered to people even at a distance, that is remote, even at a far distance, such that they can access all components of medicine, whether in terms of diagnosis, in terms of treatment, in terms of prevention of diseases, in terms of research and evaluation, and the continuation of healthcare, even in terms of education of healthcare. the complex of healthcare are being delivered in a remote manner via information communication technology. So, but just to touch a little bit in terms of evaluation, how do you actually know that telemedicine is actually effective, or how do you evaluate it to know how that remote care is working in a particular area? You know, is what talk about in terms of the access to care. How many people can access this remote care? How many encounters or claims can people can lay- can can verify and say that okay, we can actually access this particular care service in this hospital through telemedicine. You know what services, some of the services are available in the rural areas. How can people in the rural area access the medical facilities? You know, how many people are using this service? If you check the number of people in terms of the provider and the patient, how many people are using this particular service? And then you can look at it from another angle. That's what experience. You know, are the providers and the patients, are they satisfied with the telemedicine with the remote medicine experience? Are they satisfied? Does it deliver the particular aim of healthcare, which is to provide of medicine, which is to provide qualitative healthcare to people? If the experience is a good one in terms of that the aim is achieved, then in terms of evaluation, such remote medicine is doing well. And then we talk about how patients, comply with the requirements of the telemedicine, because one good feature about telemedicine is that it has specific requirements that both the provider and the patient has to join together for it to work. So um, how does the patient actually um, like matches this criteria being set? How effective is it? How do they comply with it? So another major thing to consider in evaluating telemedicine is time saved. Time saved. Because one of the components of normal medicine is that people have to travel from a particular location to the hospital. Yeah. But with telemedicine, time is actually saved. Using those technologies to facilitate the provider's ability to deliver healthcare to people. Time of both the consultation time and product time are actually being saved. So, to what extent can we integrate telemedicine to a healthcare facility in order to save the time of patients? So, when you look at this, the components to which we can say this telemedicine is actually working, or this telemedicine has failed in a particular area. Thank you.
Thank you. Thank you, Madam Durgadash, for joining today. We are discussing on remote medicine. There is one question from our audience. What is the job opportunity in telemedicine area? India is billions of people live in India. On the other hand, I know that especially many healthcare workers for global communities actually come from India. So what is your views about that? What is the prospect we have? And especially the youth community, they want to know the job opportunity for telemedicine area. So you can guide them.
Hi, Sharif. Thank you for having me as usual. Sorry, I was a little late to coming onto the show. I had another meeting that I had to finish to get on. So I apologize for the delay. My first experience with telemedicine, if you will, was 25 years ago with a company in California called Health Hero. Right? It was so early in those days, but at that time they worked with the veterans of the US, where one of the primary focuses of getting into telemedicine and remote care was mostly preventive because they felt that the cost of treating a patient in hospitals where the beds were minimal, the issues are more, and the cost of taking care of a patient after the event of falling sick or unwell was actually very prohibitive. So they actually created something called a health buddy, which they was a little device which they sent to your home, connected it up, and it monitored your day-to-day health, whether it was blood pressure or diabetes, whatever. The next thing they did was provide medicine itself at the location, right? to make sure that the patient could take care of their, what they need to take care of before it becomes an issue. About 15 years ago, I invested in a company called Purple Teal, which took this buddy like device but put it on a phone, on an SMS. And Purple Teal then worked with all the telcos around the world, about 20 telcos around the world, to do monitoring of patients and supporting them in managing their health using an SMS on the phone. This obviously became useful and prevalent when the mobile phone became ubiquitous and it was available in the hands of everyone. When it comes to actually telemedicine today, in my opinion, we've moved from preventive to monitoring to potentially, like Alo said, taking advantage of an immediate situation where you don't have access to doctors, you don't have access to immediate relief or urgent care. So you actually can, through telemedicine, communicate to your doctor of choice through a network and take care of the urgent need before you can actually travel into a hospital. When it comes to actually job opportunities in this space for the youth, telemedicine has, like I said, from 25 years ago in my connection with them to what we're doing today, so many things have evolved, so many things have happened now because of the phone. But what it has also opened up is the doors of how what kind of services can be offered in various stages, whether it's preventive, whether it is in monitoring, or whether it is in urgent care. And there are opportunities not just for specific workers like the nursing community that is predominantly from India that go all over the world, but it is also in people on the non-nursing, whether it could be delivery of medicine right into remote locations, elder life support and care, where you don't need to go to the hospital and you give them basic support and services. And those are opportunities are also that are opening up on several networks to take care of people. Interestingly, I read somewhere in Switzerland now you can actually buy health points, health support points. So I can, because I'm young, go and take care of older people, and then I bank my hours that I've done in support with this health center. And when I grow old or when I have an accident and actually need help, I can unbank that service for free, and somebody else will come and take care of me. So this is something that's started in Switzerland, and I think it's going to become very, very prevalent in Europe. And I hope it's a great idea that it goes all over the world, especially in India, where we have so many older parents because everybody goes abroad and parents are left alone here. If you're here and you can actually take care of old people and bank those hours, and then you're not available, somebody else will come and take care of your parent and you can unbank those hours, right? And it's a platform that can be built, and I think it's a great opportunity for young people from an entrepreneurial point of view, from being trained to take care, so that when they're old and they need care, someone else can take care. And it can be a commercial success as well. So I think there are opportunities in telemedicine, remote care, elderly care, and especially using devices that are now easily available, internet that is easily available. I think there are many areas that young people can look to focus, and not everyone needs to become a doctor or a nurse, which takes time and money to get qualified.
Thank you. Thank you. This is really great discussion, especially for our audience, because we are trying to bring different topic. And I want to give thanks to all of our speakers because they support our initiative. That's why successfully we launch around 480 episodes. And I want to give thanks speakers as well as the supporters, sponsors, those who support World Talent Economy Forums. Soon we're gonna launch more effective project with World Economy Forum. So hopefully it will be very effective for us. Now I directly want to go for the concluding remarks for today's discussion. First, I request Mr. Saleh, what is your concluding remarks for today?
So thank you. So it's my pleasure to talk regarding this topic, because actually the remote medicine quite popular in Bangladesh, India, and other developing nations. So it's always pleasure to talk about some contemporary issues. And so I would like to thank to Professor Shori for inviting me here, and I've learned a couple of things from the distinguished guest that are presenting here at this moment. So actually. to me, in order to ensure the sustainable development and to address the SDG 3 properly, that is the health and well-being of the country. So remote medicine is a good platform to ensure the healthcare facility uh, from any corner of a particular country, because sometimes it is utterly impossible to travel from one place to another, and due to the COVID, as we know that we are facing lots of travel restrictions. So this remote medicine is like a blessing from the Almighty. So and we must appreciate, and we must blessed this facility. So on. So thank you so much.
Thank you. Dr. Kumar, what's your concluding remarks for today? Can you unmute, please?
It always happens. Yeah. Thank you so much, Sharif, for inviting me in this. And it's really great to share thoughts and ideas in this forum. And always it's a pleasure to share thoughts here. And as would seem in like all these brilliant ideas has to come to action is only by grants and funding, as Mr. Our friends were saying. No, I mean, like the infrastructure becomes a big issue in trying to build an good internet system and computers and high resolution cameras. So in those areas, I mean, we've been a lot of countries have been concentrating recently, and it has the manufacturing cost has to come down to support this good cost. As I said earlier, this could be a better solution than the existing system in terms of social, economical, and uh, environmental point of view. So I hope this system will continue and support the sustainability and innovation. Thank you.
Thank you, Dr. Kumar, and wish you all the best because I know that trying to shift your career from India to Scotland. So hopefully your journey for research and everything will be very fruitful. So thank you for
Thank you.
joining today's session, Mr.
Thank you so
Uguchuku.
much.
What's your Thank you, Mr. Uguchuku. What's your concluding remarks for today?
Okay. First of all, I want to thank you so much for this invitation today. I'm actually glad that I'm here to talk about this particular topic. Like I said, in Water Economic Forum, we try to bring different topics to actually improve the audience, which I'm privileged to have featured in time. So I thank you, Sheriff, for inviting me. As we all know, the SDG number 3, which is focused on, that is the Sustainable Development Goal number 3, which is focused on good health and well-being for all, is is a goal that has to be pursued from multiple angles if we are actually to achieve that goal. And telemedicine is a critical component if that goal is going to be realized. And that is where my concluding remark just comes. That those challenges we note in the telemedicine aspect, in remote medicine aspect, which create infrastructural development, the high cost of setup, and in terms of resistance to change, and the lack of affordability of telemedicine gadgets or remote medicine gadgets, you know, all these factors can be improved either through financial aid or maybe sending more, like we have Doctors Without Borders, or any way that we can introduce these facilities to people in the third world, to people in developing countries like Nigeria and other African countries, and India, Bangladesh, and others. Anyway, we can ensure that we democratize, use that word, telemedicine services or remote medicine facilities to these countries, either through the government or direct aid, will be very much appreciated if we are to actually achieve the SDG number 3, which is health services and good health for all. So thank you.
Thank you, Madam Durgadash. What's your concluding remarks and what you want to advise, especially for the developing world, for improve their healthcare system?
So when we talk about telemedicine, in the last so many years, it's always been about how do I, as a doctor, reach out to patients that are not able to come and see me or visit the nearest city. So, how do we take the city to the village, right? And that's where telemedicine has been primarily focused. I think when you say telemedicine, one must not think of only, whether it is assessing a patient's health and medical help or surgery, but one must think of it more holistically, right? Prevention is always better than cure, and so far telemedicine has been about cure and taking care cure to the remote regions because they have not had access. Why not take prevention also to the remote regions? And now, as everyone knows, the mobile is available everywhere. I just got a news that an Indian film has been selected in the best documentary series for the Oscars for this year. And they talk about the Dalit women who are using phones, and they have formed a new newspaper, all video based, run by Dalit women, capturing journalism on the ground in remote locations, knowing the problems of Dalits in their own regions. Now, if Dalit women who are not encouraged to speak out can become journalists, which is actually a very dangerous field to be in nowadays, I think the phone should be utilized for prevention. Remote care should become, first to begin with, preventive, and I think those who are building apps and content should focus on preventive care and in multiple languages. As you know, in India, we have so many languages, and we have yoga based apps, meditation apps, sleeping apps, wake up apps, exercise apps. We have all the apps, but they're all very English based, right? Because that's the audience we're trying to tap into. I think we should tap into a language based audience, take the same preventive health, holistic health, right, using the mobile and the network to small towns and villages where they do have access now, and do it in the language that they understand, and help these women and young children stay healthy. And I think prevention always is going to be better than cure. So I think telemedicine needs to go that one step further to start at the beginning. Thank you, Sharif. Thank you for having me.
Thank you everyone for joining today's discussions, and especially uh, the World Talent Economy Forum initiative we are taking because we care about people. We are definitely advocate for modern science, engineering, and technology, but we love to contribute uh, through the process of young talented people, because we know that many talented people, definitely with the help of people like Madam Durga Das, those who are senior citizens, those who are from the developed nations, definitely they're going to guide us. But the young people from the developing nation, they should support this initiative. So that's why I request all of our speakers as well as all of our audience, please share our content as much as possible. We are taking many initiatives for research, uh, for startup development, uh, for academic activities development. So with your contribution, hopefully we can change human lives in developing world. Thank you. Bye bye and take care.
Thank you, Sharif, for calling me old. Good night.
Thank you. Thank you.
Good night.
Bye bye. See you.
Thank you. Bye.
Thank you. Thank you.